So, good evening, everyone. I'm Dr. Praveen Kumar Etta, nephrologist from Virinchi Hospitals, Banjaras, Hyderabad. So, in today's live program, we'll discuss on the newer advances in dialysis in year 2020. If you see the types of renal replacement therapies, which are simply called as RRTs. So if a patient is having severe form of kidney failure, when the kidneys are not working properly by more than 90%, that means if usually the GFR is the glomerular filtration rate, when it falls below a threshold level of usually 8 or 10, then it is called as severe kidney failure, and it is called as stage 5 CKD. That is also called as end-stage renal disease. Usually the category of GFR is usually less than 15, and for a dialysis requirement, usually we see a GFR level of less than 8. So in these patients, when the kidneys are not working properly to a such severe degree, they require some form of therapy which can replace the renal function. So these therapies are called as renal replacement therapies, or RRTs. So these mainly include dialysis and transplantation. So we have discussed in last live program the newer advances or innovations in transplantation. So in this program, we discuss on developments in dialysis. Okay, dialysis, even though it is means it's a lesser effective therapy compared to the transplantation, but many patients, because of not affordable or non-availability of donors, many patients are kept on dialysis before transplantation. So if you see the total number of patients receiving renal replacement therapy, only 10 to 15% of them they receive transplantation. Remaining 80 to 85% of them they receive dialysis. So in the dialysis, we have mainly two types of dialysis. One is hemodialysis, another is peritoneal dialysis. Hemodialysis constitutes the majority of dialysis programs, and it constitutes 80% of all dialysis therapies. Only 20% of therapies are contributed by the peritoneal dialysis. So if you see the innovations or developments in dialysis, so first of all, we talk about hemodialysis. So if you see the olden days, that's in 1950s, the 1940s, the dialysis was done using special equipment made up of rotatory drums. So it was discovered by William Kolff. So these drums were later on replaced by simple dialysers, which are called as membrane filtration. So if you see a normal hemodialysis method, so if you see this picture, so here a patient is receiving dialysis where the blood is going out from the body and is filtered in the dialyzer, and is again after filtration the fresh purified blood is pumped back to the patient. That is the actual hemodialysis. So this is the dialyzer. This is the actual dialyzer. So this is actually also called as artificial kidney. So the filtration happens. So where the blood goes from one side and gets purified in the dialyzer, and the purified blood comes out of the dialyzer and is returned back to the patient. And if you see, there are two side ports. Here, the dialysate flows in the opposite direction, in the direction opposite to the of the blood. So this is a newer form of the dialyzer which we are using for last 3 decades. And there are again a few latest developments in the dialysers also, where different pore sizes of dialysers are available. The normal dialysis, what we have seen, it normally functions mainly by diffusion process. So diffusion means it is a movement of molecules from high concentration to the lower concentration, and which mainly removes smaller molecular weight toxins, which mainly include urea, creatinine, all those things. So these small weight toxins are removed by normal dialysis, that is called filtration by diffusion method. That happens in normal dialysis. So and with recent developments, so the other forms of purification methods have been added to the diffusion, which mainly include convection. So convection method is if you see the physics, the convection mainly removes larger molecular weight toxins. it is nothing but solvent drag. So when the water moves from high pressure concentration, high pressure region to the low pressure region, along with the water, certain toxic substances are also removed. These toxic substances are usually of high molecular weight toxins, and these process is called convection, and the process of purification is called as hemofiltration. So what we have discussed is hemodialysis, which mainly functions by diffusion, which removes mainly small weight toxins. If you see the convection, the process is called as hemofiltration. So, and it removes larger molecular weight toxins. So this convection is a newer method of blood purification technique which occurs through hemofiltration. And if you combine both diffusion and filtration, that is removal of both small molecular weight and the larger molecular weight toxins, it is called as hemodiafiltration. Hemodiafiltration means hemodialysis plus hemofiltration, which removes both small and large molecular weight toxins, which removes by both diffusion and convection. That is called as hemodiafiltration. So this is a newer method of blood purification for hemodialysis requiring patients, and which removes almost all types of toxins which are accumulated in the body in patients with renal failure. It is the most advanced form of therapy nowadays. Even in Greenchi, we have almost 4 machines we have for hemodiafiltration, and many patients are undergoing it. And if you see a normal hemodialysis patient after 3-4 years or 5 years of hemodialysis, they become very thin, pale, malnourished, and very weak. So if you see a patient of hemodialysis, you directly observe him that he is like a dialysis patient. So like that. So they become very weak. But with the hemodiafiltration, which is the advanced form of blood purification, we can maintain the nutrition status of the patient, and it also removes effectively the toxins. So their diet and appetite and the nutrition status, and if you see the scientifically, the inflammation, oxidative stress, they're all very less, and the hemoglobin is also very much better in these patients. So they behave like a normal patients usually. These hemodiafiltration patients, which is also called as HDF. So that is a advanced therapy of hemodialysis. So if you see the development of hemodialysis and other types of hemodialysis, we have SLED form of therapy. SLED is nothing but the slow low efficiency hemodialysis, SLED. This SLED is usually done in patients with usually have low blood pressure from the beginning. Some patients with diabetes or cardiac disease or heart problem, they have lesser BP. So in these patients, we can put them on SLED. That is another form of hemodialysis, which is a low speed hemodialysis. Okay, and another form of dialysis which can be kept on patients with very low BP, that is called as CRRT. That is called as continuous renal replacement therapy. That is called as CRRT. That is again advanced form of therapy which is usually required for sick patients with very low BP, and usually it is done for inpatients, not for outpatients, because inpatients who are admitted in the ICU having low blood pressure, we usually keep them on CRRT. So if you see the hemodialysis developments, we have discussed about hemofiltration, hemodiafiltration, CRRT, that is continuous renal replacement therapy, and SLED, that is slow low flow efficiency dialysis, low efficiency dialysis. That's called SLED. So these are all again the developments of dialysis, and we have discussed about rotatory drum dialyzers, and now we are using the membrane filtration dialyzers, which is a miniature form of the dialysis. So these are all the newer developments in hemodialysis. And if we go into further depth of the topic, we have again home hemodialysis now coming up, especially in US. They have home hemodialysis program now becoming more active. So even in India, it's picking up in metropolitan cities, where in the home itself will arrange the reverse osmosis water filtration system, and they can purchase or they can buy a machine on rental basis also, and hemodialysis can be done at home. And the cannulation of the fistula can be done by technician or the patient himself if he is trained. So that is again the newer development that is happening in the field of hemodialysis. That is the home hemodialysis. Okay, and the recent developments again we have wearable devices, that is wearable artificial kidney, which is called as WAC, that is WAK, that is wearable artificial kidney, where the dialyzer is kept attached onto the body. So it's like a belt where we can wear onto the abdomen, and where the dialyzer is like a it's a rectangular platform, and the dialysis happens while the dialyzer is attached to the body. It's like a belt we have to wear. That is called a wearable artificial kidney, where the patient can move and he can go to his job and he can do his own work, and the dialysis happens continuously. So that is again the newer development in the dialyzer, that is called as a wearable devices using wearable artificial kidney, wearable dialyzers, okay, where we can wear the dialyzer onto the abdomen and we can roam around. So that is again the newer development. And if you see the recent innovation, again it's the you must have heard in newspapers, it's the implantable dialyzers are coming out now. Implantable means I'll show you one picture. So if you see this has come in actually newspaper, okay. So if you see this picture, so implantable dialyzer is like this. So there is a machine which is attached inside the body like this. This is a rounded one, and where it is attached to the blood vessels, okay. So in the blood vessels, so from the blood comes out of the body and gets filtered in this device, which is placed inside the abdomen, and after blood purification, again the purified blood goes back to the patient. It is attached inside the body to the blood vessels, and the main advantage of this implantable device is it functions continuously, and the dialysis happens continuously like the natural kidney, and it has also another function of not only the blood purification, but also it has endocrine and metabolic functions, because it can produce vitamin D, it can produce erythropoietin similar to the normal kidney by placing few kidney specific cells in the device. So that is a implantable, if you see the heading also, that is an implantable artificial kidney. So this is the newer development in the field of hemodialysis, that is an implantable artificial kidney. So we have discussed advances in the hemodialysis in the form of dialyzers, in the form of newer filtration methods, that is hemofiltration, and we have discussed about CRRT and SLED in patients with low blood pressures, and we have discussed about home hemodialysis and wearable artificial kidney, where we can wear certain devices onto the abdomen, and the latest development is the implantable device, where the device is implanted in the abdomen and the dialysis happens continuously like the natural kidney. That is again the newer development. If you see the hemodialysis, so for the blood to come out of the body and gets purified in the dialyzer, we require some form of access, that is called as vascular access. The most common vascular access in acute dialysis, what we keep is the central venous catheter, either in the neck or in the legs. That is the femoral or jugular catheters we need to put. That is for acute dialysis. But if you see the chronic dialysis patients who is undergoing dialysis for continuously or long term, they usually have fissulas. Fissulas means they are nothing but where we communicate both artery and vein of one of the upper limbs, usually right or left upper limb. Usually left is more preferable because we are all right-handed persons. So usually on the left hand side, usually we made a small surgery to connect the artery and vein, so that the vein becomes more prominent and we can needle the vein so that the blood comes out of the human body and gets purified. So that access is called as the AV fistula. And the newer development in AV fistula, previously 4 or 5 decades back, there was the shunt that was kept for using dialysis. That's called a Scribner shunt. Shunt is an artificial device where we need to connect both the artery and vein. Later on, it was replaced by the fistula. Fistula is a natural thing where just we need to suture both the artery and vein. We have to communicate both the artery and vein. That is the fistula is the newer one. And if fistula is, if the veins are poor, we will make a graft. Graft is another second most commonly used access after fistula. And in recent developments, the fistula, normally we do fistula by making a suture, making an incision and then suture the skin. But recent developments, the fistula is made percutaneously, means where we need to send some trocar and dilators through the artery and vein, and no need to incise the skin, no need to make a big incision or making sutures. It is a percutaneous method of creation of AV fistula, which is coming up, which is in it is actually is in experimental trials, and the human studies also become successful, but is not yet available in India. The expertise is not available in India, but in Western countries they are performing in limited numbers. So where they are doing fistulas percutaneously without giving any incision. That is again the newer development in hemodialysis method. Okay. Again advances in the machines also have come. Usually what we use the normal hemodialysis machines, what we usually the most commonly used machine is the Fresenius 4008 machine, and the newer facilities are being added to the machine, like body temperature monitoring, use of cold dialysate, sodium profiling, ultrafiltration profiling. They are all the newer developments that have happened in the hemodialysis machines. Okay, so and the latest for hemodiafiltration we are using 5008 S machine of Fresenius. Okay, so and again it has again another advantage of body composition monitoring, where we can accurately predict the ultrafiltration rate and so on. Okay, so these are all the newer developments in hemodialysis. So coming to the peritoneal dialysis. Okay, so peritoneal dialysis, I have told already that peritoneal dialysis is not very much picked up, especially in Hyderabad. Only 20% of all patients of dialysis, they are on peritoneal dialysis. Why? Because this may be the major reason is the government is offering free dialysis only for the hemodialysis, not for peritoneal dialysis. Okay, and in each town or in each district we have newer hemodialysis centers they have developed. Okay, and they're coming up. So hemodialysis has become more widespread and become easily available to the common public, whereas peritoneal dialysis is limited to few centers. So like our center in Virinchi Hospital, we are doing weekly, at least monthly 4-5 peritoneal dialysis initiations. We are doing new patients, we are putting on peritoneal dialysis every month. But this is not the case with across the city or across the state, and peritoneal dialysis is not actually favored over hemodialysis because of non-availability or lack of expertise and like so on. And even the government is not supporting the peritoneal dialysis. But even then, peritoneal dialysis has its own advantages. Okay, the most important advantages are it can be done at home. It's a home-based dialysis. Okay, where peritoneal dialysis is done by patient himself or the attendant who can help them, and it can be done at home simply. Okay, without need of any special instruments or machines. It can be done simply without any need of specific equipment. So it's a basically home-based dialysis. No need of going to hospital multiple times a week. Okay, there is no extra expenditure required for traveling. And the most important advantage is the blood does not come out into the machine and gets purified. So here there's no risk of any blood-borne infections which can spread across the hemodialysis treatments through the machine itself. If you see the hemodialysis machine, if you see the hemodialysis centers which are not properly maintained, there is high prevalence of hepatitis C virus infection in hemodialysis patients, because hepatitis C or any other blood-borne infection can spread from one patient to other patient if the machines are not maintained properly, if the aseptic precautions are not maintained properly. So this is not the case with peritoneal dialysis. So peritoneal dialysis can be done conveniently at home, and there is no risk of any blood-borne infections, and there is no loss of blood during treatment. So if you see the hemodialysis patients, usually because of the inflammation, because of oxidative stress, and there is also loss of blood during each treatment because blood comes out of the body. Okay, so all these things are not present in the peritoneal dialysis patients. They are more healthy, and there is no need of vascular access peritoneal dialysis. We need to put a small tube in the abdomen, and we can put a special fluid into the abdomen and keep for a few hours and then drain. And this cycle repeats. Okay, in peritoneal dialysis. So peritoneal dialysis, there is no need of any vascular access where blood needs to come out of the body, that is not required in peritoneal dialysis. So, okay, so especially the diabetic patients or heart failure patients where they cannot tolerate hemodialysis because of low blood pressure and frequent hypertensions during hemodialysis. These are all best patients for peritoneal dialysis, because peritoneal dialysis does not require any form of vascular access and there is no risk of hypertension during dialysis. And peritoneal dialysis is a smooth form of continuous form of dialysis. So there is no fluctuations in the body composition or the body volume status. So there is no risk of any heart arrhythmias or hypertension or cardiac stroke. So these will not happen. And heparin is not required for peritoneal dialysis. Whereas hemodialysis patients, we need to give heparin also to prevent blood clotting. And heparin has its own side effects. So the heparin is not required in peritoneal dialysis patients. So peritoneal dialysis is done conveniently at home, and it is without risks of any hypertension or cardiac stress, and no risk of any bloodborne infections. And the requirement for iron or erythropoietin are very less for peritoneal dialysis, and there is no need of any heparin use for peritoneal dialysis. Okay, and the need of and the residual renal function. This is the most important point. The most important thing that is required for dialysis patients for their survival is the residual renal function. That means the whatever the kidney is functioning, it may be very less, like 5% or 10% of the normal kidney, but that 5% is very much important for the dialysis patient, because that maintains the larger molecular weight toxin removal and also maintains blood pressure control and so many metabolic functions. So thus and small amount of urine, even though it is very less, like 100 ml or 200 ml, so that residual renal function is very much maintained in peritoneal dialysis patients. But in hemodialysis patients, the residual renal function is lost in very few months. As early as 3 to 5 months of hemodialysis, the urine output drops down drastically. So which is not the case with peritoneal dialysis. So that is briefly about the introduction of peritoneal dialysis. If you see the types of peritoneal dialysis, we have mainly CAPD. CAPD, it's called as continuous ambulatory peritoneal dialysis, which is simply called as manual peritoneal dialysis, where we can do bag exchanges manually by our own hands. There is no need of special equipment. That is called as a manual peritoneal dialysis or continuous ambulatory peritoneal dialysis. Okay, that is the most commonly used form of peritoneal dialysis and is cost effective also. And another form of peritoneal dialysis is the automated peritoneal dialysis, which is also called as a cyclic peritoneal dialysis, where you use a machine which is called as cycler, okay, which maintains or which pumps the fluid into the abdomen and which drains automatically. So the cycles are repeated by the machine itself. That is where the machine does the peritoneal dialysis. That is the cycler PD or the automated peritoneal dialysis. It is usually done at night when the patient sleeps. Just we have to connect to the cycler machine. The tube, the abdominal tube, need to be connected to the cycler machine, and that machine does the exchanges automatically. That is a cycler peritoneal dialysis. So if you see the developments in peritoneal dialysis, so we have several developments in it. The one we have discussed, the cycler use of cycler. Cycler is again a development in peritoneal dialysis. Okay, and the solution what we use is normally conventionally we use dextrose based solution. That is a standard to keep the fluid osmotically active, because we need to keep some osmotic agent in the fluid to drag the extra fluid from the body. So the most commonly used osmotic agent is the dextrose. So dextrose based solutions are the conventional solutions which are commonly used. So if you see the developments, we have again the several types of solutions are now becoming available. The most common non-dextrose solution that is available is the icodextrin. Okay, icodextrin is usually used for long bells. Long bells means usually 10 to 12 hours well, or at least 8 hours well we have to keep for icodextrin. So that is another one. And there is amino acid based solutions are available, which are not widely available in India, but it's also very costly, but it is available. Okay, it can control the malnourished state also, because amino acids are converted to proteins. So there is another development in peritoneal dialysis solution. And we have several developments in the peritoneal dialysis catheter itself. Initially, we have several forms of catheters that are available, but most commonly we use a straight or swan neck catheter. So that is a recent one. And there are developments in the cuffs also. What we use routinely, the double cuff or two cuff catheter, what we use routinely. So there are again several modifications in the catheter itself also. So these are all the developments in peritoneal dialysis. So this is a live program, so we will concentrate on a few questions which are asked online. So first question is, will dialysis heal my damaged kidneys? Okay. So as I told, dialysis is a form of renal replacement therapy. So dialysis is a substitute for kidney function. So as the name RRT, that is renal replacement therapy, indicates, it's a replacement for lost kidney function. So when the kidneys are damaged or when the kidneys are not working by more than 90% and the kidney function is less than 10% of normal, then at that time he or she requires renal replacement therapy. Usually the most commonly used form of RRT is the dialysis. So dialysis is just a replacement for the kidney function. So when the kidneys are damaged, we have to replace the kidney function. Kidneys are normally, they maintain our body homeostasis, they maintain fluid balance, they maintain electrolyte balance, and kidneys have some metabolic and endocrine function also. They are helpful for erythropoietin production, which are helpful for maintaining hemoglobin concentration. They are also helpful for vitamin D production. They are also helpful for blood pressure maintenance, because of production of renin hormone from the kidney. So all these three important hormones are produced from the kidney: renin, erythropoietin, and vitamin D. So all these functions, in addition to the excretory function, excretion of metabolic waste products which are normally formed in the human body, they are all excreted from the human body by the kidneys. So excretory function, metabolic function, maintenance of fluid and electrolyte balance, all these are disturbed in patients' renal failure. So these dialysis try to control these disturbances by replacing the renal functions. So dialysis is required only when the kidneys are not working properly, and dialysis does not means it does not cure the kidney disease. It acts as only a replacement for kidney function. It does not cure by itself. It does not cure the kidney disease. That has to be understood. Okay. So we'll see the next question. So what are the different types of dialysis? Somebody is asked. Already we have discussed already. We have two major types of hemodialysis, dialysis, whether that is hemodialysis and peritoneal dialysis. And in peritoneal dialysis, again, newer development is again similar to hemodialysis. We have wearable peritoneal dialysis. So similar to wearable hemodialysis, the peritoneal dialysis solution, and with the regenerating device, we can keep like a belt onto the abdomen, and it does the exchanges automatically. And the dialysate which comes out after purification, or which comes out of the abdomen, is again purified by using a regenerating unit, and the purified dialysate is again pumps back to the abdomen. So this is a newer development that is called as a wearable peritoneal dialysis. So okay, that is also a newer development. And if you see you must have noticed that there is development of artificial kidney in the laboratory also. So stem cells have been used for production of artificial kidney. That is still in experimental trials. And if you succeed in clinical trials by next 1 or 2 decades, it may come into the clinical practice, use of artificial kidney as one form of renal replacement therapies. But it is not still into the clinical trials. It's still experimental, or animal models are being studied using this artificial kidney. So this is not practical at this point of time. So okay. So we have discussed several developments in hemodialysis and peritoneal dialysis. So we'll see next question. So will the peritoneal dialysis can improve the kidney function? Okay. So if you see we have already discussed, we have residual renal function in patients even with the dialysis, the kidneys, they work very less. That is called as residual renal function. So this residual renal function is well maintained in peritoneal dialysis patients, but not in hemodialysis patients. Okay, so that is another advantage of peritoneal dialysis patients. Okay, so we'll close this live program. We'll end this live program by saying thank you all. So we have an excellent dialysis program available in our Virinchi hospital. We have several advances in treatment that are available in our hospital. We have online hemodiafiltration that is available with us, and all types of peritoneal dialysis also we do routinely in our day-to-day practice. So thank you all. We'll end this. Thank you very much.